Hello and welcome to North Country Matters. My name is Donna Seymour. I'm a member of the St. Lawrence County League of Women Voters, one of the civic partners for this show. My guest today is Krista Hesdorfer. Krista is the Director of Public Affairs for Hunger Solutions New York, a nonprofit organization dealing with food insecurity across our state. Krista, welcome back to North Country Matters. You've been a guest on the show before, and each time the situation with hunger in the state seems to get just a little bit worse. To be fair, much of the bad news in the last few months has all been on the federal side of things, but we're in the budget season here in New York State, so we have an opportunity to address some of these shortfalls, don't we?
We do, and thank you for having me. It's always a pleasure to be able to speak with you, but I do hope that in the future we'll have a more positive opportunity to convene because you're exactly right. Food insecurity is worsening in New York State. It's getting worse instead of better. And there's two reports that we can look at to understand those trends. Earlier this winter, the USDA released its annual household food security report, and that showed a 36% increase in food insecurity in New York State when comparing 2022 to 2020. But more recently, the Urban Institute released a report on food insecurity in 2025. They use a slightly different methodology, so their numbers tend to be higher overall. But even so, the findings were really alarming. They found that 24.4% of adults, about 1 in 4, experienced food insecurity at some point in 2025. They also noted that food insecurity is rising among moderate income households, really reflecting this broader affordability crisis that we're seeing. So both reports, the USDA and the Urban Institute, show a clear trend of rising food insecurity, and both reports came out before these major federal cuts and policy changes are coming into effect, widely anticipated to worsen food insecurity even further.
You know, I just had Andrea Montgomery on the show. She's the St. Lawrence County Office of the Aging Director, and she talked about the dire situation that in our county that seniors are facing between the SNAP cuts and the delays in HEAP, which is the heating supplement. So we had seniors in this county who were both hungry and cold for far too long this winter, a winter which has been a bad one for everybody, and we've really seen how prices have escalated even in just the last few weeks, which makes everybody, regardless of their economic sense of security, more fragile than it was. So let's talk about some of those cuts and changes to the federal SNAP program and what it will mean for the young, the old, and the poor in New York. These are very deep cuts that will make a bad situation much worse for people, aren't they?
Yes, the federal budget reconciliation bill that was passed over the summer includes $187 billion in cuts to SNAP over the next 10 years. That's the largest cut to SNAP in American history. And the bill does that in a few different ways that affect people differently. First, it expands work reporting requirements that essentially place a 3-month time limit on SNAP for many families. It expands those to more older adults who were previously exempt and households with children who were previously exempt, as well as some other groups like veterans and youth who are aging out of foster care. In addition, the bill further restricts SNAP eligibility for humanitarian immigrants. So refugees and asylees who were previously able to receive SNAP will no longer qualify unless they have legal permanent resident status. HR 1 also reduces SNAP benefit amounts over time by making some changes to budgeting rules and household deductions for things like utility expenses. And we know that those benefit amounts were already inadequate. So now we're going to see even more families who run out of SNAP benefits well before the end of the month, before they have any additional resources to buy more. The bill also shifts significant costs from the federal government onto our state and county budgets, which of course makes it harder for states and localities to respond and support the people they serve.
You know, the scariest phrase you just used was increasing utility costs, because that's all we're seeing. Whether it's the price of energy, it's the price of gasoline, it's the price of fuel oil, all that stuff is starting to really skyrocket in the last few weeks. So in late January, a coalition of lawmakers and anti-hunger groups in New York asked the state to allocate hundreds of millions of dollars to address those budget shortfalls that are going to be leaving too many New Yorkers hungry. Let's talk about some of those proposals. What is it that those groups are looking for the state to do?
So Hunger Solutions New York is leading on two primary budget asks this cycle, and they both focus on protecting New Yorkers' access to SNAP and WIC. So we're really galvanizing around increased funding for SNAP navigators who help families access SNAP benefits and maintain their benefits even as these federal changes are coming. And we're asking lawmakers for additional funding to support local WIC agencies across the state to make sure that families can access that program, which of course serves our youngest New Yorkers, pregnant, postpartum people, and children up to the age of 5. I can share a little bit more about each of those asks as we, continue with the program, but we also support other coalitions and convene partners around a broader anti-hunger agenda that includes some additional priorities like an increase in the minimum SNAP benefit. Currently, the federal minimum SNAP benefit is $24 a month, which gets you just about nothing. So we want to see New York State bump that up with state funds and guarantee a $100 minimum benefit for anybody who participates in SNAP. We're also working with a range of partners on funding for more secure EBT cards for SNAP and for summer EBT to make sure that families are protected from benefit theft through skimming. And we're working with partners on an ask for a state-funded food benefit, specifically for families who are excluded from SNAP due to their immigration status, and with particular focus on households with children and people who are newly ineligible based on those changes in HR 1 I mentioned for refugees and asylees.
So those are really vulnerable parts of our population. Dr. James McDonald, who is the New York State Commissioner for Health, has drawn the link between good nutrition and health. With additional cuts to Medicaid and other health care programs by the federal government, any cuts to nutrition and food programs is really a double whammy for folks, isn't it? So this affordability crisis in the country is growing, literally day by day. From a recent report, about 1/3 of Americans, roughly 82 million people, say they have had to make financial sacrifices in order to cover healthcare costs. This is about families skipping meals to afford medication or stretching out their prescriptions to make the medicines last longer, which we know is not the optimal way to take a medication when you're sick. What's even more frightening is the rising cost of diesel fuel, which is the primary fuel used for shipping, agriculture, and other industries, which means higher operating expenses could soon be passed on to consumers in the form of price hikes on retail goods, groceries, and other commodities in a time when groceries are already sky high. And one of the things that we're starting to watch is the high price of diesel is causing slowdowns in shipping. So you're even going to see shortages like we saw back during COVID with the shortages. And when those shortages include food, the most vulnerable are really in trouble, aren't they?
They are, and you're exactly right that there are all of these intersections between health and nutrition, food security. So when there's issues of food insecurity, it increases healthcare costs, it increases chronic diseases, mental health problems. It's really urgent that New York State responds in every way that it possibly can, because you're not only affecting whether somebody can put food on the table today, you're affecting those long-term health problems that affect our whole society, right? So it's really strong, sound investments that have return for the state over time.
So what we really need is for the governor and the legislature to act right now to address these issues in the budget, because this is the best chance we have to get something done. What does Hunger Solutions want to see the final budget look like when we're talking about these issues?
We're really prioritizing access to SNAP and WIC because these are our nation's largest and most effective anti-hunger programs. One of our major asks this year is for $8.5 million to sustain New Yorkers' access to SNAP navigators. These are folks working in local community-based organizations who help families through every step of the process of applying for SNAP and maintaining their benefits. That service is going to be absolutely critical as these federal cuts and policy changes are making SNAP harder to access. Unfortunately, SNAP navigators were also cut as part of HR 1. So the federal portion of funding that supports this application assistance is going to be cut in half starting in October. So if we don't get an added state investment in this year's budget, we'll need to scale back SNAP navigators right when families need these services the most. So we're asking for 8.5 million, and we were pleased to see that amount in both the Senate and Assembly 1 houses. We've got our eye on that piece in the final budget. We're also, as I mentioned earlier, really focused on a budget ask for WIC. So WIC is luckily was untouched in the HR 1 cuts. It remains this really critical, stable support for families with young children, but you need to be able to access the program, and you do that through local agencies that administer and operate the WIC program on behalf of New York State and the federal government. WIC participation in New York has actually increased by about 25% in the last 5 years, which is a huge victory. We've been doing a ton of outreach in partnership with the state. There have been some program modernizations that have made it easier to access. And as a result, we're reaching about 100,000 more women, infants, and young children with this critical program. But at the same time, the WIC agencies that run the program have been nearly flat funded. So they're now operating well over their target caseloads. They're experiencing really significant budget shortfalls, staffing reductions, long wait times for appointments. So we need to shore up that infrastructure and make sure that families can still access this program, that they can access it in a really timely way, because we know that those periods of development for young children are critical. You can't wait on WIC access. And we need funding that supports outreach so that we can reach about 200,000 more New Yorkers who are estimated to be eligible for WIC, but not yet participating in the program.
You know, the point you make about good nutrition for young children as their brains are developing is so important. One of the best provisions of last year's budget was full funding for the Universal School Meal Program. What is that program going to be funded this year? What do we know about the status of it, Krista?
So New York is standing firm behind its universal school meal program, and with very good reason. It's been just a smash hit success. The data is still coming in. We're in our first full year of universal school meals, but the preliminary data tell us that meal participation is expected to increase across the board, including in schools that were already able to offer free meals for all students through the existing federal provisions. And this is what we expected to see. When you make meals free for everyone, when you make it a truly universal program, the stigma is removed, operations are smoother at the school district level, they can focus on innovative service models that make meals more accessible. Universal meal programs also just raise awareness of the availability of school meals, that they're free for everybody. So all of these different factors have come together, and they ultimately mean more kids are eating breakfast and lunch at school. It's a huge relief for families at a time when we're looking at these cuts to SNAP and Medicaid. The grocery prices are still rising. You at least know that your child is going to have the food that they need, breakfast and lunch every school day, no questions asked.
And the only downside of that is vacation days and summer when school isn't in session, because that throws the burden right back onto the parents who are in the same financial constraints they were in to begin with. So really, this is something that we can't let fall by the wayside, and we need to find a way to address the summer meals program better than we do right now, don't we?
Yes, so there are 2 federal programs right now that provide support for families in the summer. There are traditional summer meal sites where kids can come and get a meal, And there's also a fairly new program called Summer EBT that provides a $120 benefit per child to help families stretch their grocery budgets in the summer. But there's definitely room for growth in both of those programs. We need to make sure that there's sites available in all parts of the state, that families are aware of where they can get those meals, and we need to connect more families with summer EBT benefits, and at some point at the federal level, increase those benefit amounts. We did see that Governor Hochul in her State of the State book included some language around increasing availability of summer meals and doing interagency outreach for summer EBT. So we were really encouraged by that, and we will look forward to working with her team in any way that we can to reach more families over the summer.
Yes, and so one of the things that we can do as citizens, this is also because it's budget season, it's also budget advocacy season. So it's going to be important that we as citizens find ways to send messages to our legislator and to the governor that we want to protect these vulnerable citizens and get them what they need. What is it? How can citizens help in this process? What's our role in advocacy, Krista?
Well, nothing speaks louder than constituent voices. So at this stage in the budget process, we are in final budget negotiations. And those negotiations are largely between Governor Hochul, the Senate Majority Leader, Andrea Stewart-Cousins, and the Assembly Speaker, Carl Heastie. So we need folks to reach out directly to those three leaders and to your state senators, to your state assembly members, and ask them to weigh in with leadership as well. We have some easy to use tools to make it a little bit easier for folks to engage. If you visit hungersolutionsny.org/take action, you can find an email form that's already ready for you. You can customize it so that it speaks to your experience and priorities, and very quickly send a message that goes to all of those leaders as well as your state assembly member and senator.
And I will be sure to put those links in our show notes. And you make a great point about how important advocacy is around the personal story. Tell your story. Tell the story of your family so that they realize who is going to be helped or hurt by their actions. That's really an important thing. Another piece of the food picture in this country is the federal farm bill, which has not been reauthorized for several years, but it looks like it's actually maybe going to get across the finish line this year. So there are some not great ideas in the federal farm bill, aren't there? It's kind of a continuation of HR 1 in terms of really cutting programs that people absolutely need. So tell us a little bit about what's going on with that, please.
Right. So the Farm Bill proposal at play does nothing to repeal or delay any of the HR 1 cuts to SNAP. And we were really disappointed, to say the least, to see that. We know that it's absolutely essential for the cost shift provisions that were in HR 1 to be ideally completely repealed, but at the very least delayed, to allow states and counties an opportunity to prepare, to lower their error rates, which are what's being used to determine the cost shift, and to make sure that they have the infrastructure and resources in place to minimize harm. But the Farm Bill did not do any of that. It maintains all of the HR 1 cuts, and it also includes some provisions that would privatize certain SNAP functions that are currently not allowed to be privatized, specifically around eligibility determinations for cases. There have been pilots in other states where they have privatized case decisions on SNAP, and it's been an unmitigated disaster. There have been wrongful denials, inaccurate information sent to families, very long delays in SNAP timeliness and processing. So we definitely can't let privatization make it across the finish line in a farm bill. Our perspective, and it's shared among many in the anti-hunger community, is that no farm bill is better than a bad farm bill. We can have our programs continue to operate. SNAP will continue to operate as is if there is no Farm Bill reauthorization. But if there are further harms to SNAP in a Farm Bill, that's a non-starter. It's completely unacceptable. And we really need a Farm Bill to repeal and delay some of those HR1 cost shifts and other harmful policies.
You make a great point about the harm that a privatization does, because we know that that is just a way to take federal money and put it into the hands of companies who are not in business to take care of people. They're in business to take care of their shareholders. So that's a huge problem. We see privatization happening in healthcare. We see it happening now, the potential to happen with food. That is just not the right answer, and it is certainly not the solution to solve some of these long and deep problems that we already have. So thanks for bringing that up. I also want to point out that 2026 is an absolutely critical election year. If you don't like what Congress is doing, you're going to have the chance to change who you send to Congress this November. And there are lots of people who are not even going to, they're not even running for their seats. They're getting out of Congress, which means there'll be open seats and an opportunity to really examine who wants to be in Congress and what their ideas are. We can really make a huge difference this year if we send the right people to Congress who are more interested in making good decisions, because we're desperate for good decisions out of this Congress. So, Krista, what happens to people, kids, adults, seniors, who don't have access to the food they need? Too much of rural New York State is a food desert where there are no full service grocery stations in too many communities. What are the health and wellness outcomes for people with limited transportation, limited income, and too few choices?
Food insecurity has a wide range of negative outcomes for people, regardless of age. For our young children, it inhibits their development, their focus and learning when they're in school, puts them at increased risk of mental health problems like anxiety and depression. For our older adults, it increases the chance of chronic diseases. And of course, it increases healthcare costs too. So even for folks who are not swayed by the human impacts, food insecurity has real costs for society as a whole. So it's a moral imperative to invest in anti-hunger programs, but it's also smart policy.
Smart policy. I remember when we used to do that. I haven't seen it lately, but it'd be nice to turn the clock back to smart policy. So as we wrap up here, Krista, any final thoughts? What do you want people to be thinking about, and what do you want them to do? How can they take action to make a positive difference?
I just want to reiterate what we spoke about earlier with constituent voices. It is absolutely critical for listeners to be weighing in at the state level during final budget negotiations, but also with their federal representatives. Make your voices heard, share what you're seeing in your community, share what you saw in the fall when there was this unprecedented disruption to SNAP during the government shutdown. Share what you're hearing as these expanded work requirements are coming into effect. How are they impacting people in your family, in your community? Make those stories known and share your priorities with your lawmakers. That's absolutely critical. We're doing what we can at the state level, but members listen to the people they represent much more than they listen to anti-hunger organizations in Albany. So I would just encourage folks to weigh in any way that they possibly can. Reach out if they need resources. Visit our website and our social media channels. We have easy to use outreach and advocacy mechanisms there, but just stay engaged.
Thank you. And thank you for all the work that Hunger Solutions is doing, because it is needed more than ever. And you've been around for decades now. So the work does not go away. The need does not go away. But hopefully what we're learning how to engage better so that people will be able to take advantage of the resources that organizations like yours have. So thanks, Krista, for coming in today and having this conversation with us. And I agree with your earlier comment was, I would hope that the next time we meet, we have good news to talk about and not these dire predictions of things that it's a human tragedy. It's what is happening to way too many families in this state and in this country, and we can do better.
We absolutely can. Thank you again for having me on, and I appreciate you and your listeners' attention to this issue.
Well, thank you for coming in. And again, thanks for your work. I want to remind our listeners that these conversations are a production of North Country Matters. This show is a civic collaboration between the League of Women Voters of St. Lawrence County and the Potsdam Public Library. Until next time, remember, our North Country matters, and so do our neighbors and their access to food. So let's do what we can to send that message to Albany and to Washington, because it is a dire, dire situation for thousands and thousands of people, and some of them right in your own home community. Thank you.